A couple other questions came in. One was about contact tracing. So you may have heard about that. Again, a lot of media attention over the last several months. So what contact tracing entails is when we identify a positive case, we get notified, we'll reach out to that individual who has a confirmed COVID-19 infection. And we'll talk to them obviously about their situation and what they need to do to prevent infecting others. But we also gather information from them to try to find out who they were in close contact with, like I just described, within 6 feet for greater than 10 minutes. And we then reach out to those individuals and encourage them to self-quarantine if we feel like it was a significant exposure. Then they'll be given advice. What made this even more challenging with the bars and the nightclubs is most of those individuals, other than the group they went with, have no idea who they were around during the course of an evening. So that's why we made the public aware. So right now we have an adequate staff with surge plans in place to increase our capacity to do contact tracing. So we have no concerns at this time. And we have the flexibility to bring more staff on, which actually we're doing right now to meet a growing demand that we anticipate is likely going to happen over the next week or two. Another question that we received was regarding age groups. And it will come of no surprise given the conversation we just had. It's the 18 to 29-year-olds where we're seeing most of the cases. There are older individuals getting infected, not necessarily associated with the bars, and that's likely to happen because somebody who goes to a bar or really any type of large gatherings without taking the appropriate precautions, that then gets spread further out into the community as people go to their workplaces or go home and may infect family members, which is not that uncommon. So right now, the trend in Ada County is very similar to what we've seen statewide in Idaho and definitely what's being publicized in the media around the country.
Russ?
Sure, go ahead, Dr. Epperly.
Yeah, just two other quick points on this. The infectivity rate we're seeing with the COVID-19 in Ada County is 7. What that means is that for every infected individual, if you're in close contact for greater than 10 minutes or more, then the risk is 7-fold of that person spreading it to another. In other words, for every infected individual, the data is showing right now 7 others will be infected. So you can just imagine the multiplication factor of this. With this 18 to 29-year-old demographic being the majority of infected people, we know anywhere from 25 to 33% of those won't get symptoms. That is a problem. Good for them, but not so good for people in the family they go home to that don't know they're infected. And if the infectivity rate is 7-fold, then you can see the fact that indeed a lot of people can get the infection from an unknowing family member. This starts to have a major impact then for older people in the homes, grandmothers, grandfathers, fathers, parents, people with immune compromising conditions, people with chronic illness. All of a sudden, there are vectors into the house. It starts to become a problem. Now, the typical coronavirus across the nation for the early part of this pandemic had an infectivity rate of 2.5. What we're seeing in our community is an infectivity rate at 7. So for whatever reason, this is almost a 2 to 3-fold increase in infectivity that's happening with the outbreak that we're having here. Hence, again, part of the rationale why we're jumping on this as hard as we are right now.
Okay, we have more questions that have come in through the chat. Is when will we move to stage 4? And as we discussed this with the board, the decision was made, we don't want to put a specific timeline on it and build up expectations when the reality is we're not sure how this is going to play out. So we didn't put a time frame on it, but we are monitoring a couple of key factors, which we will publicize later today or tomorrow on our website to look at not only the cases that are getting reported, but also looking at hospital emergency department visits for COVID-like illness. So those are two specific measures we're going to be evaluating. And when we get to the point where we feel comfortable, we're starting to see a decline, and not just 1 or 2 days, but a steady and sustained decline in cases and reduction in COVID-like illness, then we'll look at modifying our public health orders. There's also a question about publicizing this criteria, which I had just answered. We're going to get that out there as soon as we can. A lot of the data we already published as far as the COVID-like illness information and information by county, but we'll make that transparent to the public as far as what we're looking at, the data itself, and how we're making decisions. And then there was another question about a hotline. So we do have a call center set up. You could see that on our website. It's published pretty prominently. And right now it's open Monday through Friday from 8:30 to 4:30 p.m. And the phone number is 208-321-2222. That's 208-321-2222. And we'll expand the hours as needed depending on the call volume. I know there's a few more questions coming in. I'll get those here in a second. Okay, 2 more questions. One is in regard to movie theaters. Will they stay open? And the answer is yes. They will not be included in these orders. They definitely need to follow all of the protocols that many of them have put in place in order to open, which includes the social distancing and face coverings, both of staff as well as the guests. And of course, like any employer, they need to be mindful of employees who become symptomatic or test positive, or who are around others who have tested positive, and take appropriate action. The other question was, why do we seem to have such a large impact in Boise relative to the other cities? So within our district or within Ada County. And my explanation for that is twofold. Number one, it's the largest population. It's a very dense urban community, and we also the cause of the uptick in our cases was for sure related to individuals who were infectious, who were in the downtown Boise area and socializing with large crowds, and lots of individuals who would have been exposed who weren't part of that immediate group. So I believe that is why we're seeing more cases in Boise, but it's not confined to Boise, and it doesn't take long to spread further out into our communities, as we have seen.
Director Duke, John with Boise Devon, and I'm not sure why I'm the only one who can unmute. I guess the independent media gets the day here, but can you help me understand how this will be enforced, if it will be enforced? Is the Ada County Sheriff involved in that? How does that work?
Yeah, that's a great question, and that is why we do have Ada County Sheriff Bartlett on with us right now, and he's available to answer that question. Sheriff?
Yeah, thanks, Russ. Absolutely. I'm in the middle of this. I am also communicating with all of our Treasure Valley chiefs, and hope to be on a call with them at 2 o'clock, just so we can all be on the same page as we navigate through this. Our big conversation is somewhat similar to what we did when this kicked off in March, when we initiated our major campaign for education with not only our business owners, but also our bar owners. And I know this is Ada County, and unlike a lot of other places, but we are very happy with the response and the relationships that we were able to build and continue on with our business community and bar community. I echo what Russ and Dr. Epperly is saying. This is not a decision that gets made lightly, and it is one that we're going to continue to work through, and hopefully we'll be able to get these numbers kicked back down pretty quickly. But from the law enforcement community, we'll be getting this order from the health district and tying that directly in with a message from our law enforcement community here in the Valley, and get out and get started on that education as quickly as we can, as we've done over the last couple of months. What will the enforcement side look like? Obviously, we work very closely with the state ABC group. If we did have somebody that was not cooperating with this order, but I'm very hopeful that we'll be able to gain compliance through education. Matter of fact, a lot of our bar owners are the ones that have been at the table trying to get this figured out so that we can protect our citizens here in Ada County.
May I follow on that, please, Dawn? You know, one of the things I keep hearing from folks is that they want to patronize responsible businesses that are following the guidelines. And I actually would point to your website as helping to share that, some of that information. I'm really hopeful that through the One Idaho effort, we'll continue to be able to amplify that. Businesses who have signed on to say that they are following all the protocols, so that we can kind of have a movement of our dollars to patronize businesses who are really doing a great job.
Thank you, Commissioner Lasciando and Sheriff Bartlett. So that we have some more questions coming in. So what would cause us to make the decision to move to stage 2? And basically, we will rely on the data that we are monitoring. Again, the criteria will be published. The data, for the most part, is already published. And the real challenge is going to be, we're trying to predict something that's going to happen in the future and have to make the modifications today to see that those changes occur. So I don't have a specific answer as far as exact case counts or ED visits for COVID-like illness, but those will be discussions we're going to have with the Board of Health and with our disease investigator team, and then make decisions from there. I will say, I understand a staged approach from a reopening perspective. I fully supported Governor Little in his structure. I think that made total sense. And I also think it makes sense to bring this back to the regional level. Boise County, for example, within our district, has 0 cases. So this county by county approach makes sense. The rest of the state can move forward through the various stages, with stage 4, I believe, will end this coming weekend. But as far as our decisions and what stage we go to, it will really depend on what we're seeing in the primary care setting, case counts, and impact on our hospitals.